It's an absolute privilege to be here. Thank you so much, Rachel, for the invite. It's very exciting to see all of this coming together in this first international openEHR conference. 20 years ago, I decided that I wanted to be a nurse. There was something inside me that was telling me that I wanted to dedicate my life to taking care of people. And that came in hand with the absolute privilege of working in different healthcare organizations with amazing leaders. But there was also something that I could see that healthcare had at that point in time, and still has, a lot of opportunities for improvement. And technology could be a great enabler to help us solve through some of those challenges. So when I decided to get into the intersection of healthcare and technology, and I started to dive deep into my dissertation as I was conducting my PhD, I was focusing on, okay, how can I look for a topic that brings together the why of technology in healthcare back to the clinical basics. And that was about patient safety. So let's get back to the basics first. Whenever we start our clinical studies, we all have very, very present the Hippocratic Oath, right? Do no harm. And most of you are probably aware of the study that was published in 1999 by the Institute of Medicine, To Err is Human, where there was some stats around 3.7% of the hospital admissions would suffer an adverse event. To put that in perspective, I don't know how many of you fly here. I did, came by plane yesterday. That's the equivalent of a Boeing 747 crashing every day and everyone dying. This was more or less 25 years ago. We would expect that to have improved, but unfortunately, reality is that today, nearly 1 out of 4 admitted patients in a hospital still suffer an adverse event, 4 out of 10 in primary care, and most importantly, 50% of those are preventable. There are 12 million of errors in diagnosis per year. And around 20 to 30% of spending healthcare is considered waste in inefficient processes. Okay, so then what is really the framework that we should follow whenever we are approaching any digital transformation project, program, journey? In my mind, we should be coming back to having a framework, and I think the quintuple aim is a great framework to guide us on that journey of making sure that anything that we do comes back to deliver value and deliver outcomes, right? And that can go all the way from how we help improve the patient experience. I prefer to call it person than patient. I think the person concept is bigger than patient, right? And we heard from Dave today the importance of having empowered and engaged patients. Improve the clinician experience, improve population health, lower costs, and increase health equity. So what is the role of the cloud in all of this? And why is it so important to consider this part of the equation? Well, AWS is the world's largest technology infrastructure provider, and we have a very unique way to build our infrastructure. We build what we call high availability zones. Our high availability zones are comprised by 1 or more data centers, and wherever we have 3 availability zones, we create a region. This is twice the availability zones and 3 times as many data centers as the next largest cloud provider. We have more than 18 years of experience in healthcare, and we have announced several investments. I'm just going to relate to the 7.88 investment in the European Sovereign Cloud that is set to launch this next year. Okay, how all of this translates back into healthcare? The Health Policy Partnership published a report last year called Our Health in the Cloud that I encourage you all to have a read at, and gave some very specific examples on how a cloud infrastructure can help really deliver better digital transformation. So for example, how we can interpret CT scans in seconds instead of hours. How can we process a molecular panel in 15 minutes instead of 10 hours? Did you know the data contained in a genome is equivalent to 100,000 pictures? So think about the amount of compute that you need to really sequence a molecular panel. How can you build public health dashboards in a matter of days when it's needed? Or how can we make actions happen in seconds instead of minutes in an EMR? So as a nurse, I always like to think about this with the person, the patient in the center. And I always, across my career, I always told my teams, I might not be yet in the front line anymore, but I'm certainly are in the second line. Because I'm helping other clinicians do their job better, right? We, as people, as patients, as persons, we work with thousands of data points every day. And those goes beyond, obviously, the EHR, right? We talk about social determinants of health, economic data that have an impact on our health. Healthcare data volume doubles every 2 years. And it's predicted in 2025 that 463 exabytes of data per day will be generated and billions of genomes will be sequenced. More importantly, the healthcare industry is one of the industries that is suffering the highest number of cyber attacks. We are seeing a 60% year-over-year growth in cyber attacks in healthcare organizations. And we are seeing a trend, right, on how we are using that data to drive decision-making. Traditionally, clinical decision support alerts that we would find on an EMR, for example, are based on 30 to 40 data points. These are usually the sequence of if-then, right? If a patient presents these vital signs and is in this situation, then do that. Those type of sequences are looking at around 30 to 40, depending on the complexity, data points on an EMR. Inside an EMR, we are calculating to have around 200 to 300,000 data points. And with the hype of generative AI and the ability to incorporate large language models, then think about the exponential growth of the data that could be used to drive decision-making. So how is it happening? We were talking before, I think Dave mentioned this in his keynote this morning, using generative AI to capture the information across different systems, all the way from hospitals to primary care, and generate a summary for a patient in a language that they do understand. That's a use case where you can use generative AI for, right? Okay, the professionals and the processes. I love the fact that you related to the lean processes. I'm a huge fan of lean. As a matter of fact, I worked a lot of years on that. And I think it's certainly a great guiding principle to really think on how to make processes more efficient. We are facing a shortage of clinical professionals, as we all know, right? It's estimated to be 10 million in 2030. This is huge. Nearly half of the clinical professionals are suffering burnout. And although this is a multi-cause issue, there is one major reason that if you ask any doctor, any nurse out there, they will tell you the amount of time that they are spending on unnecessary administrative tasks that are not bringing back any value to patient care. We need to change that. We need to fix that. We need to take that out of the equation. So how do we make clinicians practice at the top of their license so what they can really use their time for what they were trained for? And this goes all the way, and these are some examples, right, on how you can take a hospital and help ease the operational processes. those times that I was mentioning before, those tasks that are taking 15 minutes right now, how can they take 15 seconds? That's pure performance. That's pure availability of the system. Don't have your clinicians waiting for screens to open. Don't have your clinicians waiting, right, for different applications to come together. Take that out of the equation. And then, on top of that, innovate and improve the time to innovation. The Hospital Clinic of Barcelona, who has migrated 80% of their IT systems, including the EMR, to the AWS cloud, is now looking for innovation opportunities on, for example, how do you reduce the no-shows? And how do you use generative AI to help you reduce the no-shows? Solving for real problems that are affecting clinicians and patients, people that are using the systems. All the way to enabling first cloud policies, right? I mean, NHS Spine as an example that has moved to the cloud, or the work that we are doing with the India's National Health Authority for 60 million of hospitalizations, or in Australia where we are helping build a digital front door. These are just examples on how you can, once you take the burden out of the operational process, focus on the innovation instead that is really helping solve some of these challenges. Reimagine care with clinical voice-enabled AI services. Did you know that for every 2 hours a doctor spends with a patient, it's on average that is spent 1 hour documenting? We have technology that can help with that, right? Bring it to the forefront of the strategy. If we truly want our clinicians to trust the change and be part of that change, we need to deliver value to them. So where are we seeing this tipping point of generative AI? Well, because there's been a massive proliferation of data till now, as I was mentioning before, and now that data has been available, right? Scalable compute capacity, and on top of that, enable machine learning innovation. But artificial intelligence is not new, right? I mean, we've been talking about artificial intelligence for the past 25 years. So what's really the difference on generative AI, and why are we seeing this hype with generative AI? Comes back to the foundation models, right? So traditionally, we had a narrow AI that would look at data that needed to be labeled, right? That had to be trained through machine learning, and that data would generate specific tasks that we will tell that data to do. Well, now with foundation models, what we are seeing is that we can unlabel that data and still train to understand that information and generate those tasks. Artificial intelligence can impact 30 to 40% in health outcomes and improve 50% of financial results. But AI needs data for training, and openEHR is the perfect data model and toolset to do exactly that at scale. Most importantly, generative AI needs the cloud to scale. So infrastructure matters whenever you're approaching your digital transformation programs. AI can mean improvements in health outcomes, as we were seeing. Right now, 90% of data is trapped in unstructured formats and therefore not used for decision making. I tell my clinical colleagues, we as clinicians have also an ethical obligation to ensure that whenever we are giving a new diagnosis to a patient, for example, we are doing it so with all the data points that are available to us to really make that decision, right? Because we are changing that person's life. Whenever we are telling someone that has a dementia, for example, or an Alzheimer, or a cancer, we are changing that person's life. And we are, unfortunately, today, making some of those decisions with a small subset of data on all the data that is available to us, because it's captured on formats that is not brought to our decision making at that point in time. Let's listen also to an example on how we can approach health equity on Huron AI and giving Rwanda cancer patients better access to life-saving treatments.
A woman or a man's geography shouldn't determine whether they live or die from a disease. There's one oncologist to 300 cancer patients in the United States, one oncologist to 3,000 cancer patients in Africa. We can really use tools like GenAI to close that gap to advance health equity. The whole goal of Huron AI is to make cancer care more accessible and available to everyone, everywhere. Oncologists can monitor all their patients with our intuitive data analytics platform. Physicians can use several generative AI tools and save time and money. With Bedrock and what our team have built, you can call the patient directly from our software. That whole conversation is recorded and saved, and the transcript is done automatically, and then we have a clinical summary for that conversation. We can know exactly what interventions have taken place for a patient. That just makes medical care and oncology care more streamlined. Even though these are the early days, GenAI is coming to stay, and so we need to build fast to ensure that we don't leave a lot of people behind.
So this is happening in Rwanda, but isn't this applicable also to rural care? For example, I was having this exact same conversation with a regional prime minister a couple of weeks ago of a region in Spain, and on how we could develop techniques to make care accessible to those populations that live far away from a hospital, that live far away from a city, right, and still need that access to healthcare. So artificial intelligence is the new member of the care team. And I want us to think about this. We have a new member on the care team. We need to define their competencies, define the skill sets, define how we train them, define how we incorporate them into our clinical practice, and how do we do that in a way that delivers value. So just to end, so the value of a cloud-first strategy: deliver secure healthcare. AWS, we have 143 security certifications and the ability to encrypt data in transit and in rest. This is a question that I often get asked a lot. Build a coherent operational environment. I think there was a study several weeks ago published in the US that a normal hospital has around 180 applications as part of their IT systems. How do you bring that together in a coherent IT operational environment where you can gather that data and really drive decision making? Drive patient and clinician satisfaction, improving performance, disaster recovery, and system reliability. I'm from Spain, so it's difficult for me not to mention what's going on in Valencia right now. Sorry about that. We always think that will never happen to where we live. I'll just leave it there. Unlock the value of data and deliver personalized care. Advanced health equity. We can, right? We can democratize access to clinicians and patients to digital transformation. And leverage the cloud to realize cost savings to accelerate time to innovation, as I was mentioning before. At the end of the day, what we are looking at is use the right data in the right moment by the right person to make the right decision. Thank you.